Hello, and welcome to another edition of Your Therapist Needs Therapy podcast, where two mental health professionals talk about their mental health journey and how they navigate mental wellness while working in the mental health field. I'm your host, Jeremy Schumacher, licensed marriage and family therapist. And today I am joined by Dani Falesnik. Dani, thanks so much for joining me.
Thanks for having me.
I start every podcast the same way, which is, how'd you get into the mental health field?
Accidentally. So, my my kind of journey on this started, I think, when I was a teenager myself. I had a really excellent therapist who's still kicking it, I think. And I always knew that I wanted to work around people, with people. And when I got into college, by the grace of God, I really didn't know what I wanted to do, right? I didn't know for sure I was going to be a therapist at that point. I was into art. And I was going to be a ceramicist. That's kind of what I thought. Then I was like, well, it's kind of lonely staying up, feeding a kiln all night, unloading stuff. There's a lot of heavy, hard work. And my elbows and my wrists were starting to go out. And somebody had mentioned art therapy as a potential career choice. And I was like, is that like for sad paintings or like really rich people who just, like need pretty art to look at? I had no idea what I was getting into.
Sure.
So I actually started taking some coursework around grief and bereavement because I needed some kind of psychology minor. So I actually went the human development route and got my master's eventually from Mount Mary College in Milwaukee. And I became an art therapist and a licensed professional counselor and a substance abuse specialist. So it was kind of like a one foot in front of the other, one step at a time.
Sure.
And I don't know, how some therapists, their journey through educational systems are pretty varied, and especially, the whole licensure thing. But yeah, that's kind of where I ended up, and eventually decided to open my own practice because, there's less quota concerns and more directionality on my end, which is really nice.
Yeah. Yeah. Do you mind going into that a little bit? Because I have a lot of private practice owners on, and it's one of the things I like to talk about, how unhealthy the medical model and the insurance system is. So I'm always curious people's kind of journey into their own private practice.
Yeah. So, my last employment experience was not bad. I was working in Fond du Lac. The difficulty was that through that medical model, a lot of it is about numbers and how many client face-to-face hours you can get in a week. And many therapists know just because you have a 60-minute session doesn't mean that that's the end of that work, right? We have notes and documentation and follow-up and case management. So they had this grand idea to start working in the schools. And in order to see more patients, it was half-hour sessions. And let me tell you, that burnt me out quick. Just because, people need more time. Just because 30 minutes is up doesn't mean somebody's ready to stop talking. So eventually, I really wanted to follow my passion working with queer and neurodiverse adults. And so that's what I started to do. So in the past, I have had my own brick and mortar thing, and have now transitioned back to teletherapy until, kind of get caseloads up and running and a little bit smoother operational systems in place. But yeah, definitely winging something we think maybe we should not be winging, but here we are doing it anyways.
Well, yeah, it's so interesting, especially working with like the neurodivergent community. Like, I never wanted to have my own practice because I assumed, somewhat incorrectly, that the business part of it would be too taxing. Like, I'm ADHD, that's not how my brain works. And so I just always assumed it was so restrictive that I wouldn't be able to swing it. And then after working at bad places with bad ownership or unethical places or whatever, just getting to the point like, if these folks are doing it poorly and making a profit, maybe I can do it and be okay.
Yeah.
And but for most of us, we don't have, I don't know what Mom Mary was like, but like I went to Marquette, I didn't have any education on business, how to open a practice, how to run any of that stuff.
Yeah. What to expect with taxes, all of that, what's an LLC? How do you do that? What's that? Like, what?
Yeah.
You mean I
And a
should
lot of,
just run it under my name and not get sued?
right. Right. And trademarking and all that stuff.
Yeah.
Yeah. And stumbling your way through it, you know how to do the therapy and you know how to connect with people, but the business is like a whole separate profession almost.
Absolutely. Absolutely. But it's I did take a hiatus between October and May, where I was working for another larger health system briefly. And, when I had kind of softly shut the doors last fall, I did so knowing that I would likely return back to it.
Yeah.
And it did not take long for me to realize, like, what have I done? Like, quick, open the shutters, throw the doors open, like we're going back into this, because it's hard to see. I think it's almost like a siloing of just people who really need mental health care services, but they're kind of like herded and cattled around, right? Like that's like, I'm trying not to say like some weird dystopian post-apocalyptic situation, but it kind of feels like that sometimes. And so, my aim is really to make this less scary for people, and a safe place to come and really work through whatever it is that they've been afraid to work through or have felt really misunderstood. Because again, in that large healthcare system, if your general practice psychotherapy, you just get whatever walks in the door,
Right. Yeah.
So if I am looking for queer competent care and I get parked with, Sally Joe, who, is attending Episcopalian church every day, it's kind of, it makes it uncomfortable to talk about those things. So,
Right. Yeah. Yeah. And working with the queer community, working with neurodivergence, I mean, some of that neurodivergence, people don't know they have it until they're in therapy. And a lot of queer folks are not comfortable for very valid reasons going through something like insurance or having a paper trail that's showing that's what they're looking for with their therapy. Wisconsin's one of those weird states where we're sometimes liberal leaning and also very conservative laws still very much on the books.
It's very
so it's
yeah.
And you're in the Fox Valley, which is, outside of what we maybe think of as the progressive safe havens of Milwaukee and Madison.
Surprisingly though, Appleton is far more progressive than I had ever anticipated. So, we're seeing, I'd say even in the last 2 or 3 years, a big kind of opening of arms to people who are in the queer community. People are a lot more supportive. And it's kind of hard to gauge it now because with Pride just ending, everybody still has their Pride flags up and all that.
Sure.
But even year round, I'm seeing a lot more inclusive spaces kind of trying to pop up. And I'm really supportive of those businesses as well. A lot of them are my friends, and we do what we can.
Yeah. Quick shout out to shop local and support queer owned businesses. What, if you don't mind sharing, what was kind of your journey with neurodivergence? If it's a lived experience you have, where was that kind of a specialty or a population that you decided you wanted to work with?
It was again, kind of like wandering around like an errant child. I finally figured it out. I had a pretty significant head injury when I was 13. I was in a car accident, and you never really had any formal follow-up from that, which is kind of surprising, but also not. It was the late 90s. But after, working for a few years, I think I was 10 years into practice at this point, and I was like, man, just something's off. I had already been diagnosed with ADHD. I knew that was on board and alive and kicking and well. But I was like, there's something else. And so I started working and got a neuropsychological evaluation on myself. And sure enough, I am spectral and ADHD, and all the gray matter seems to be where it's supposed to be, which is a good thing, but it just fires a little differently. And so it's been really fascinating as a clinician, even to just see where ADHD, like any of those neurological, so ADHD, OCD, and autism, how our preconceived notion of that, even as trained clinicians in the field, is like, we're looking for people like with hand flapping stims, we're looking for people with large vocal stims, and it was fascinating. The other day, I had my partner was talking to me about, like, how can somebody say, well, you don't look autistic? And I said, Google it once. Google, what does a person with autism look like? And you see people with like Down syndrome, with like muscular dystrophy. It's just like it doesn't make sense. They look like me. They look like my children. They look like just normal people. And I think that whole paradigm of like, well, it doesn't show, so you must be very high functioning. It's like, no, I'm very much at risk for burnout, but I'm learning, right? And so I think, when people say, what's the point of getting an autism diagnosis in your adulthood? Well, there's a lot of reasons, right? Like, if we can understand how we work, how we think, what are the things that motivate us, all of a sudden we can put skills and adaptations in place and utilize things like occupational therapy for sensory stuff. And we thrive. Anxiety and the depression go away. Like, maybe not entirely, but it's a lot easier to cope with it than at that point.
Yeah. Yeah. And I talk about that. I see a lot of adults that I'm the first person who's diagnosing them. Often they're coming to therapy with a history of anxiety diagnoses, if they're female, or bipolar diagnoses. For females, people of color, that's really common, where really it's this underlying neurodivergence, and they've just been trying to manage it, but not understanding what was really going on. So even if they don't pursue medication, that diagnosis is helpful for management, for skill building. And like you said, some of the like self-esteem stuff that goes along with it, you're not thinking you're deficient, you're not blaming yourself for these things. You understand this is just how your brain works. And so there's ways to manage that and react to it that are more or less helpful. But it's one of those things where that's just how your brain works. It's always been there and it's always going to be there. There isn't a medication or a fix for it. It's learning how to work with it.
Yeah. And I think that is the big piece of why, when people are knowingly like, I have a hunch. It's like, what, if you have a hunch, you probably are, because that's the other thing that always kind of made me giggle a bit. I've seen now a few things like on social media where people kind of comment on this, but it's like, we hear like, oh, they must just be faking their diagnosis, or, they don't have it. They just need it because they wanted to. Nobody wants to fake this. I promise, right?
Yeah.
Like, nobody's looking for these types of adaptations to be needed in their life. But it's helpful. And I think it makes people feel, I guess, there's a sense of mastery that people develop once they're not, like you said, so inwardly beating themselves up with that inner critic, like, oh, I'm so lazy, or oh, why am I so dumb or forgetful or messy or whatever it is. And that compassionate voice can kind of start taking over a little bit. But yeah, I that one always kind of boggled me. They're just faking it.
Yeah.
No.
Well, yes, it's not good. It's not a superpower. Fuck that book from the 90s. But I think it's really helpful for clients too to see professionals who have lived experience, because the way we are taught and trained in our schooling is very much the medical model, very much a deficit model of this is how you do diagnosis. And so seeing someone who has it, who owns their own practice, or who's been in a business and a professional level degree for years and years and been successful, like we have this idea that autism and ADHD are people in school who are failing and not doing well, and that's what it looks like. So seeing someone who has their degrees on the wall or has a business that they run, like I think that's really meaningful for people to have that modeled for them.
Yeah. And it's funny though, you mentioned the school model and the school district, half of them love me, half of them freak out when they see me coming, because my son has ADHD and autism as well. He's going into 4th grade. He was entered into the TAG program for reading. He was hyperlexic, so he started just spontaneously reading when he was like 3.5, 4 years old, and very fluent. But he struggles with math. The mathematics in him are they like oil and water, right? And I think it's really just because that part of his brain is just not interested in it. He tries, and we had to seek some supports for him for OT to kind of keep him calm through that. Then I'll never forget, this teacher was like, he's smart, he can do it, he just doesn't want to. I said, hold the phone, hold on. I said, let me break it down this way. I'm certain you're probably familiar with pervasive demand avoidance, right?
Yeah.
And so to try to explain that to people is really tough. And I said, it's like this. So if you're standing in front of a hot stove with me and that little burner is red hot, and I say, go ahead, put your hand on that, they're going to recoil and they're going to say, absolutely not. No. Well, why not? You can. You just don't want to. And then they kind of get it, so it's like, just because they can doesn't mean that it's so cognitively taxing that can actually cause distress in people. So me being me, just kind of continuing to try to educate people on stuff like that, so that maybe someday we can shift that perspective a little bit more and help kids in school so that they don't end up being stressed out adults like us.
Yeah. Well, and something like PDA, even just the rebrand of, now my brain's blanking on the rebrand, pervasive drive for autonomy, like understanding that, right, this is a structure, institution, education that isn't designed with neurodivergence in mind. Okay. And so it's the cookie cutter approach. It's the Henry Ford factory model of everybody goes through it this way. And when you have a brain that will do it when it is properly motivated to do it, when it has reason or autonomy to choose to do it, that's not a space that we have in our education system. So it's not a skill issue, or it's not that, it's a brain chemistry issue. And so figuring out, like, right, how do we create a different format for autonomy where this child can choose where they're putting their brain energy and get rewarded accordingly, because that's how their brain is wired, instead of pretending like kids care about grades or A's at the end of semesters, or like that anything like that is meaningful to them.
Right. And if anything, depending on how much of a conspiracy theorist one is, I think that it is actively designed to kind of pull that out of kids, right? So that creativity, that out of the box thinking, that if everybody is homogeneous in that sense, then it's a lot easier to move them around, right? But I think we're getting closer and closer and closer in like really microscopic little steps, but we're not taking jumps backwards anymore, which is a positive thing, I think.
Yeah. So yes, there is that pendulum swing with the political movements, certainly. But yeah, I mean, even my 6-year-old is in kindergarten and almost assuredly has ADHD, and it's one of those things where he's at a Waldorf school, so it's a really good fit. But there's also this balancing act of, like, as he gets older, something like Waldorf has less resources, less support, and so you're looking at that balance of, like, well, this is better for his brain, for how his brain wants to do things, but also at some point we might need more support, or there might be resources that just aren't available at a small school like that. And so it's this balancing act of, again, it's not the kid's fault,
Right.
but as a parent, you're trying to navigate a system that isn't designed with your child's wellness in mind. It is designed with, how do we get most people through this to be functional members of society?
Right. Absolutely. Yeah. The old no child left behind situation.
Yeah. Yeah. Well, and like, I think we're in similar age group. Like, I grew up obviously ADHD, but I didn't get diagnosed till I was in my my last semester of grad school, because I got good grades. And so again, just the way the system is designed is to catch a certain form of impairment, and everything else goes, is either ignored or misdiagnosed somewhere else.
Right. Well, and I guess that might be a good segue. So part of, I think what makes my practice a little bit different than what traditionally people find is that incorporation of more of the metaphysical stuff. So a lot of times when people do find me, they're like, I read on here that you're a tarot reader, that you do mediumship work, blah, blah, blah. And that's been intriguing more and more people. So one of the things I noticed, I would say late 2019, maybe 18 even, and then right around when the pandemic hit, I started picking up on more and more people who had very apparent psychic abilities, but they had no concept or awareness of it. And, back then it was like maybe 2 or 3 out of my caseload I could pick up on, and I'd talk to them about that. They'd be like, oh, yeah, I've never gotten to talk to anybody about this before. Like, I just didn't want people to think I was crazy. I was like, that's okay. I already think you're crazy, but we can keep going. But then by 2022, we're knocking at like 30-40% of my caseload now showing up with ESP capabilities. So some people obviously higher on that spectrum than others, but then looking at the crossover then between autism, ADHD, OCD, and psychic abilities is insane. So I had the privilege of working with the Trevor Center in Fond du Lac for a period of time, and they do some work in kind of looking at that with people who are savants, and seeing ESP as a savant type gift, right? And it very much is. And I think some people who are starting to learn more about it definitely don't always see it as a gift. Sometimes it's kind of more of a curse, it can feel like.
Sure.
But that's been an interesting population to kind of access as well, as people who are going through spiritual awakenings. We see all these like spirituality coaches on social media and stuff like that, like, and that stuff is expensive. Like, just out of curiosity, I've put my feelers out there to see what are people charging. There's some people that are like $750 an hour, and it's like, what? So, I saw a need for that within the market. So that was kind of the drive to get my Reiki master certification. And then I've been reading tarot since I was 15. So that's going on 25 years now.
Yeah.
So it's been interesting kind of seeing the crossover with Jung, Aleister Crowley, and the Rider-Waite decks and the Toth decks, and seeing how kind of those archetypal systems can be kind of found within that, using it as narrative therapy, using it as just kind of like a fresh perspective on, how do I move forward in life?
Yeah. And I think I came across your work just searching for LGBTQ plus friendly therapists in Wisconsin. But I'm a pagan, a deeply skeptical pagan, but pagan nonetheless. And so like, I love the holistic approach. I love the tarot. I find when I work with religious trauma, which is one of my specialties, so many people leaving high control religion who are queer or neurodivergent or both, which there's a lot of overlap there, are interested in some version of, I'm going to say, meaning making that ends up looking some version of spirituality. And so I think a lot of folks are looking for, what does that look like in their life? What does that mean with less restrictive, dogmatic sort of structure?
Right. And I think it's what I find fascinating because, I'm a recovering Catholic myself. And it's hard at first, I think, and not even at first, I think just it comes and goes. It's like, it is traumatic, where, you kind of get these constructs in your mind about theology and about how spirituality is supposed to operate, the whole concepts of good versus evil. In my practice, it is very non-theological, right? If a person has, any deity or whomever that they kind of focus their intention towards to worship or honor, totally okay with that. Myself, I'm more of a source creature, right? So I'm just kind of like, I think it's just a bunch of jelly up there somewhere, right? Like, who knows?
Yeah.
But I try to frame it, especially to those populations where it's less of this like esoteric wonder and can be very fearful and fear-based, especially I pull out a tarot deck and they're like, it's a devil. It's like, nope, it's not. It's just a playing card. Not gonna get you.
Yeah.
Not gonna get me. It's not gonna get anybody. But in essence, to practice spirituality is to learn how to ground, to learn how to clear your mind of thoughts, how to be in the present moment, how to identify and differentiate your thoughts, your feelings, and then your higher consciousness, right? And so it's kind of like, if you tell yourself, like, think about what you're thinking right now. Okay, I'm thinking about running low on my soda, right? Okay, how do you feel about that? Maybe a little thirsty. Okay, and that could be anxiety thoughts, and that could be anxiety feelings. It could be pain in my back. But then kind of the trickery of the question is, then who did you tell that to? Well, I told that to myself, right? So you don't tell your brain stuff. You don't tell your body stuff. You're telling your higher consciousness things. And so just kind of helping people tap into the wisdom of themselves is a lot of fun.
Yeah. So I was super stoked to talk to you about some of this stuff today, and you brought up the idea that some spiritual coaches and wellness spaces are charging an exorbitant amount of money for stuff like this. So when you're working with neurodivergent folks, queer folks, I would say marginalized community folks who are looking for these type of services, how do you recommend that they find someone who isn't like a snake oil salesman or isn't taking advantage of them with these expensive readings or these kind of super expensive retreats and stuff like that? How do you kind of navigate that for clients? How do clients find someone like you who has lived experience and licensure that can be helpful?
And that's a really phenomenal question. So a good friend of mine, his name is Matt Schmidt, and he's a QHT practitioner up in the Green Bay area. And like you said, how do you know that these people aren't just out to make a quick buck and just running numbers and sending you whatever bogus stuff? Matt, my buddy, was he's going to correct me, I'm sure. He was a scientist. Let's say that. He was working in a lab developing pharmaceutical drugs, and it was just killing his spirit. And he knew that's not what he wanted to do. He wanted to go into something different and to help people. And I think it's about not jumping into like the clickbaitiness of it. A lot of times, if you're working with any spiritual practitioner, if they're telling you hurry up, limited time, little space, act now, any of those kind of triggers, especially for people who have ADHD, it hits our dopamine centers. That fear-based motivation stuff just goes off the charts, and we're like, quick, get my credit card because I'm gonna miss this opportunity. No, you're not. So I say take time and ask for references, ask for like, and also look at what is the refund policies with people. Like, it's in my own policy, like if you are like, this is absolute junk and I got nothing from this, okay, here's your money back, that's fine. Because I know that at minimum people will find benefit in a quality practitioner when you kind of have that, like, we're not here to take a bunch of stuff from you. And just because somebody charges an insane amount of money for something doesn't mean that they're great at what they do.
Yeah.
The other thing is really asking people, what are your credentials? What are your qualifications? In some states, I don't even know, honestly, if Wisconsin is one of them. It's probably something I should know. Again, winging things I definitely shouldn't be winging, but that you have to have like actual like tarot reading, what's the like permits and stuff like that for certain cities or certain ordinances. So ask them, are you registered anywhere with the county, with the state? Do you have any medical practice licenses? Are they current? Do you carry insurance? Right? Because
Right.
I think the biggest concern I have with people handing out just pure tarot readings as a stopgap for mental health services is that there's a risk of harm, and even in just traditional psychotherapy using empirically tested, evidence-based modalities, you can still create harm in the sense that you're going to experience an uncomfortable feeling. So then what happens when somebody becomes suicidal over hearing something that they didn't want to hear? Or, and there's shams out there where people will just like make stuff up and make it flowery, make it look good. And then these people are left out of money and feeling worse than where they started. So it really comes down to do your research, ask questions. And if anybody gets uptight or snobby, that's not your person,
Yeah. Yeah. I love that advice. I think, again, I think the quick buck and like turn it are some of the like social media influencers and some of the stuff who are not centrally located. They're not like consistently available. And so they're coming through town or they're running a retreat or a conference or whatever for a weekend. And then you're not going to hear from them again. And so that's always kind of like really high alert for
That's
me.
a red flag. Yeah, where they're like, DM me now to book a consultation. Then again, I always like testing these systems, right? Because I'm like, I don't know, what's this about? And when I send it, I get robo responses of, sorry, I'm booked up, I'm not accepting new clients. Like, then why are you running an ad? So they get followers, so they get that income based on their social media following.
And
So,
I come from the religious trauma background, being raised fundamentalist, but also then getting certified to work with it, where anyone who's sort of preaching or putting out there that they have special, unique insight or that they're the only person who can help you, again, is like really big. Even if it's a therapist who's licensed, like that type of talk is almost always like leading to dogmatic approaches and is probably some version of a scam. But that speaks to a vulnerable population, and that's what people want, is that special, unique insight.
well, and exactly. And so we're our roles as therapists is we're working with a very vulnerable and traumatized population who's just looking for help. I can't even tell you how many times my clients have been like, I am so sick of going to the doctor and being told it's in my head, and having to reframe psychosomaticis to people is like, it isn't, it isn't. Like, the pain you feel is real, it exists. It's that old school perception of, well, we don't see it, so it doesn't exist. And then I think shows like House and Grey's Anatomy like really kind of like romanticize this, like, oh, well, what if there's like a penny stuck in your ear and that's why you can't walk anymore, right? So people get concerned. And I think where mental health and even physical health systems really miss the mark is they don't communicate with one another. And, you know, Dr. Schmidt out of Fond du Lac was a really amazing person to work with for a period of time. She's an integrative medicine specialist there at SSM, and she really just did a fantastic job of taking a psychotherapist who is a Reiki practitioner. I worked alongside an acupuncturist and a massage therapist and an RN and as a team. And it was just a really cool experience to see a little segment of the healthcare system operating in a very kind of, I don't want to say novel way, but an intelligent way, and kind of like a common sense based situation.
Yeah, and that collaboration is really helpful. I mean, obviously, as practitioners, for us to have good referral sources and support systems, but like for clients to know that like it's your healthcare, it's your care. If this big hospital conglomeration doesn't want to share your stuff or isn't communicating or getting back, like to advocate for yourself. And like that's work for people. I get it. It's complex on purpose, but it is one of those things where that's why I'm outside of the insurance sphere and like connect with acupuncturists and other, you know, doctors who take private pay and stuff like that, because those are the people who are easy to connect with and who want to practice in a collaborative way, not just, you know, your client number 30 of the day and they can give you 15 minutes and then you're on your way.
Yeah, it's you know, and I don't want to be like all insurance is bad. Insurance is just a pain in the butt. It's like you need a doctorate in order to understand what you're doing, you know. But I'm knocking on 40. I have been doing this for years, and I am just now barely getting a wrangle on the actual like, how does one panel for an insurance company? And so many therapists are just like wiping their hands, and it isn't necessarily fair to put that back on the consumer to say, hey, why don't you call them, ask about a super bill, blah 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 blah, because if we're forgetting that we have an electric bill every other month, like it's going to be difficult to follow up on those really complex multi-system tasks. That's a big reason. And I did get it. I ran through and I wanted to make sure it was up and functioning before I shared it. But, you know, I'm starting Queer Connect through my business, trying to develop a fund. You know, earlier we had talked about people who are just like afraid of using their insurance because either they don't want an autism diagnosis directly on their record because of how they're treated in the healthcare system, or maybe they're married and identifying that they're maybe now gay and now they're afraid of, you know, their own confidentiality for very realistic reasons. So sometimes people can't afford it. And so my hope is to, you know, over the next couple of years, really build this up so that I guess it's socialism. I guess. Oh no.
Yeah. What a novel idea.
I really believe that people deserve access to competent care, not just like good enough care, but like, no, we need to talk about, you know, relationship differences, especially I work a lot with polyamory communities. I work a lot with kink. I work with like basically anything under that umbrella. And those are things that people are just, how do you talk to the 20-year-old that answers the phone at the giant clinic that says, and what do you want to talk about? Nobody wants to be like, I might be a top or a bottom or a switch. I don't know what that means, but I'm trying to figure it out. And it's like, you know, so they're like, depression and anxiety. And then they just kind of get shuffled, you know. So this is hopefully a step in the right direction. So people who need help paying, I keep my rates low. They're at, you know, they max out at 100. And I think for now it's one step in the right direction.
Yeah. Well, and it's, this is, I talk about this a lot because I have a lot of private practice owners on. Like, there's this back and forth for us as well. We didn't, as therapists, invest in this system. We didn't design the system or create it. We're under capitalism as much as our clients are. And
Uh-huh.
so there's this back and forth of how do we pay our bills and also make sure we're available to
Right.
people. And like, it is, I got so burnt out on insurance as a marriage therapist. That's my licensure is licensed marriage and family therapist, because they would
Trying to
cap my
figure out who's
sessions
the
all the time.
identified patient and then who's
Yeah.
terminating it.
Or you get
Yeah.
6 sessions, or you're through an EAP, you get 3 sessions. So it's like, it's great that you have insurance, but also you're not covered for the therapy that you actually need, or for the
Right.
length of therapy that you might need. Couples therapy often just takes longer. So it's just one
Yeah.
of those things where it's like, yeah, I know I'm not available to everyone based on my hourly rate, but also trying to balance it out with
Yeah.
things like a podcast, a YouTube channel, giving back in
Absolutely.
community events, like speaking engagements, like that
Yeah.
stuff that tries to be more accessible to people.
Right. So, my if I had one wish upon a star, if I came flying across this room right now, I would say anybody who's listening to this who has everything taken care of for themselves is identify local resources that are of value to you and that people find important. I had mentioned I had an anonymous donor recently just say, let me help with this,
Yep.
and that was a big decision in the past when I had kind of softly shut the doors. Was I was giving away a lot of time and energy, and it, again, they don't teach us business in
Right.
therapy school. uh and I'm like, oh yeah, I got time, right? And then that adds up and it stacks up, and
Hmm.
with overhead and utilities, etc. After a while, you're like, actually, I'm going backwards.
Yeah.
So my hope
Yeah.
is to not have that strain on me as a therapist, so that I'm able to be there and be present and be accountable and show up. Um, well, then people aren't scraping and going without
Right.
because they're so stressed they can't keep going.
Yeah. And you joked about socialism earlier, but like I've worked in higher ed. The model is there.
Uh-huh.
Uh, Not everywhere, but at D1 schools in the athletic department, the way that student athletes are treated for their, D1, Big Ten, the Ohio States of the world that have billions of dollars coming in, there's a nutritionist that they work with, there's a therapist they work with, there's a dentist that they see regularly, and all that stuff's covered for them, right? And like Dani's making the money symbol with her hands here for the podcast listeners, but like, right, that money is there. The university is making money off these student athletes, so they're willing to invest. But that collaborative one-stop shop for all your wellness for these professionals who can communicate to each other exists. We just don't offer it to everyone.
Yeah, yeah. I don't know if you saw, I haven't watched it. I know there's a documentary out. I don't remember what streaming service it's on. It's called Clipped. And it does start to talk about the word is slipping by me, but just kind of the greed and stuff behind big, like, NFL, NBA sports,
Oh,
even college now is getting, like you said, just
I'm not defending or advocating for higher ed and the way they make money off of student athletes. I'm just saying from a provider standpoint,
yeah, yeah.
that's lovely to think every professional athletic trainer, physio, nutritionist, mental health, dental health,
Wouldn't that
eye
be
care.
awesome if you just
Yeah.
had like your own entourage of like health advocates? Be like, okay, are you drinking water today? Maybe I'll stop getting angry when people ask me that question someday. I don't know, probably not,
Right.
but
Yeah. This is just a hard left turn here. One of the other things you said earlier that I wanted to go back to was spirituality as grounding.
yeah,
And I love that mentality. It kind of, again, with some of the like, how do you know if you're getting good quality help or someone's scamming you, is like, again, who's doing the work? When I'm talking with clients recovering from religious trauma, I'm very open and transparent that like, I don't know what you're going to believe. I don't really care what you end up believing. It's not up to me, like, I'm a facilitator. I'm not doing this
Right.
for you. You're doing the work. And so I find that so much of that is more helpful for people. I see people who want to do psychedelics, who want to get into tarot or whatever it is. They've left high control religion and they're looking for meaning making elsewhere, but they're used to a prescriptive nature to it. They were raised Catholic or evangelical who said, this is the way to do it. So they're kind of used to that. And they come to therapy and I'm like, yeah, I'm not telling you what to do. Like, it's all kind of up to you. And I think that's really hard for people, but that is, I love that you said spirituality is grounding, because like, right, it's finding yourself and finding your autonomy.
Well, the big joke in my practice, and many of my patients know this, is like, we all know the worksheet. We know the worksheet. 5 things you can see, 4 things you can touch, 3 things you can, like, blah, 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 blah. And I was like, what does that mean to you? And they're like, I don't know. It's like, okay, so let's break that down, right? And like, let's, my aim is always to take things that don't make sense to help them make sense of it. So even concepts like, you have to love yourself before you love other people. And I tell my patients, when I hear that, I want to bang my head against the wall, because it's like, what does that mean? Right? Because nobody ever really adequately explains it. It's like, well, you got to love yourself. And it's like, well, I do, so that's where I found, skills like looking at body integration, affirmation work, and reparenting, re-nurturing, and providing those critical messages from childhood and early adolescence that we never had. And 99.99% of the time they're crying, I'm crying, we're just trying to read through it for the first time. We're like, we're good. But it's like, how do we take these kind of like cliche terms that are just fluffed around, and how do I actually make that make sense and applicable to normal human people outside of those clinical terms, the clinical route, like how normal people talk. Like, the first time I heard my son say my peers, I was like, you're what? Like, what did you just, my peers? You mean friends? Kids at school? Like, what does that mean? And he was like, oh, yeah, I mean, my friends, so it's kind of like, let's call it what it is, and kind of break away from those things. And, truthfully, in terms of like spirituality, I think at the very, very root of things, depression born from way too much time ruminating on the past or what could have been, anxiety, way too much time ruminating on the future. So it's all time traveling, right? And if anybody were to ever ask me, what's the meaning of life? It's just now. It's experiencing now, and I will, with people who are open to it, launch off into my channeling observations and thoughts on what greater things are saying. But, ultimately, I think if we are too hyper focused on creating things, then we're going to end up spending more time going backwards and fixing mistakes than we are if we're just 2 feet on the ground.
Yeah. And I talk about like connection and meaning making a lot with my clients, is like, your meaning making is relational, your relation to where you are, to who's around you, to those relationships. Like, having some autonomy in what does that mean to you, and understanding like there isn't a correct answer to that. Like, you get to decide, you get to choose what that means to you.
Yeah.
And that can be like analysis paralysis, too many options. But like, when you learn to kind of roll with that, it becomes such a more healthy and more accessible way to be your kind of authentic, genuine self. And even those get cliched, those terms get cliched, but like, I find that like, that's overwhelming at first. And then once you kind of learn, oh, what's my body saying to me? How's my brain and body connection? What's my connection to my present moment? Like, it's telling you things, it's talking to you, and learning how to create some meaning out of that is where people eventually land.
Yeah. Well, and I think like, at the core of working with spectral populations, I mean, even OCD, communicating the thought processes at play there are so hard for people, but so detrimental to their overall well-being. So if they're like, I can't talk about why I want to, yeet this gallon of milk over the aisle at the grocery store, but I really want to do it, but I'm not going to do it. But, if I say that out loud to anybody, they're going to think I'm nuts. It's like, no, this is normal thinking behavior. This is normal kind of processes. Is it adaptive? Maybe not. As long as you don't let it lead into the maladaptive nature of things, then we can control it, we can work with it. But I definitely I see that for sure.
Yeah. I love the paradigm I always use. And again, a lot of my caseload is religious trauma. So I steer away from right and wrong, and I use helpful and unhelpful. So you said adaptive and maladaptive. Right, we can go off of evidence. How does this actually work for you, rather than what your mom or dad or society or boss or whomever is trying to tell you is the correct way to do it.
It's like that, is it like a YouTube meme or something? It's like, if you want a cheeseburger, eat a cheeseburger. If you want some French fries, eat some French fries. Just if it's making you happy, have a tea party with raccoons for all I care. Just as long as it's not hurting people or putting you at risk.
Yeah.
I think those control paradigms, like you said, of right and wrong, and that's just it hurts people. It does.
Yeah. This has been so lovely to get to chat today. If people want to learn more about your work or want to work with you, where do they go? How do they find you?
My website's pretty easy to find. It's destinofortuna.com. DESTINOFORTUNA.com. Otherwise, you can find me on Psychology Today. I have a profile there, but I try to make it as simple and least complicated as possible. There are literally 25 different ways you can get a hold of me.
Yeah. And you have a unique last name. So if people Google you, that comes up first too.
Yep. All right.
And we will have all those links in the show notes so people can find you. Dani, thanks so much for taking the time and coming on the show today.
Yeah, it's been actually really fun. Thanks for having me.
And to all our wonderful listeners, thanks for tuning in again this week. We'll be back next week with another new episode. Take care, everyone.
Bye-bye.